Ovulation typically happens around the mid-cycle if you're having a perfect sort of 28-day cycle. We expect that ovulation is going to happen 2 weeks before your next period. So in a 28-day cycle, that falls right in the middle. And so for people who are able to track their cycles on a calendar, that may be the easiest and simplest and lowest tech way of knowing when they're ovulating. You can also use ovulation predictor kits. These are urinary strips that look for the hormone level LH, or luteinizing hormone, that's excreted in the urine right around the time of ovulation. Now, these test strips may not work for everyone, especially in people who have irregular cycles. They may not always catch their LH surge, but if you do catch it, that is a way that you can tell when you're ovulating. Another way to tell when you're ovulating is to really be more in tune with your body, especially if you don't always have a regular cycle. You can sometimes pick up on some symptoms and changes that happen in your body around the time of ovulation. Now, lots of things happen in our bodies in response to the hormone shifts that happen around ovulation. The first is changes in body temperature, in heart rate, in skin temperature, and a few other things. Sometimes you can track this using basal body temperature tracking, which is sort of an old-fashioned, low-tech way of identifying ovulation, but it works for those who are tracking their temperatures. Every morning, you can see a shift in your body temperature right around the time of ovulation. Some of these fitness trackers that we wear on our arms can also track those symptoms, and they can track the physiologic changes around ovulation and can predict when we might be ovulating and when we may expect our next period. Some women are able to check their cervical mucus. So cervical mucus responds to the shift in hormones that happens around the time of ovulation and will become thicker right after ovulation occurs. And so we can use the consistency of the cervical mucus to help us understand when we're ovulating. And other women can also feel discomfort around the time of ovulation. There can be bloating and breast tenderness that happens shortly after ovulation related to the shifts in hormones occur when ovulation happens. There's also a pain that can be associated when the follicle or the cyst that holds the egg ruptures to release the egg for ovulation. Some people are actually able to feel that as a brief discomfort and pelvic pain. It has one of my favorite medical terms that's attached to it. It's called middle schmerz, which literally means pain in the middle, meaning in the middle of your cycle. But some women are able to use that as a clue to tell them when they're ovulating.